I continue to hear about businesses and employees taking unnecessary risks. I've seen examples of people ignoring these warnings. Therefore, I am currently working with the Office of our General Counsel to add to my existing executive order, under updating the executive order to say that if employees can perform their job function from home, my executive order will require that happen. To be clear, if an employee can perform a job function from home, the executive order will require that happens. If employees must be in the office, the executive order will require that they be at least 6 feet apart if possible. Look, there's obvious reasons, or obviously examples where that won't work. For example, we're in the grocery store and you have that moment when you're doing a transaction with the cashier. There's a moment where you can't do that. But where you can be, the executive will require 6 feet apart or more. It's irresponsible. These irresponsible actions put people and families of our city at risk. The more people that refuse to listen and fail to take these precautions, the longer this crisis will continue. As a former business owner, I understand the pain, the uncertainty, and the disruption to businesses and employees right now. My administration, we are actively looking at and working on some policy initiatives to provide relief. I'm also hearing stories about people congregating and partying at homes, parks, streets, and other places. This is also very, very dangerous and irresponsible. Sheriff Williams and I have been discussing a curfew. The problem is enforcing a curfew right now would put incredible strain on our law enforcement. So right now we're not setting a curfew, but we're asking you to do the right thing. If you're still having to go to work, when you come home from work, stay in your home unless it's essential, groceries, supplies. If you don't do this and we don't flatten the curve, you could see a federal or a state curfew and they will enforce it. Again, avoid any outings or gatherings that are not absolutely essential and necessary. We've been working with the state of Florida for a field hospital here in Duval County to help alleviate any strains on our medical system. At this time, equipment will be staged here, but the location of the hospital will be determined as necessary. We will share more details as they become available. At this time, this is a preparation and only a preparation. Our hospitals currently have capacity and are in good shape. This is an asset we have in the region for use if needed. Fire Chief Powers is on the call and can address any questions on this subject when we get to the question and answer. The testing sites at the Prom Osborne Center and Lot J are performing well. Since opening last Friday, our city-sponsored Prom Osborne testing location has conducted more than 300 tests. Remember, you must have an appointment to be tested at the Prime Osborne, and screening is available through Telescope Health. Since opening on Saturday, the federally sponsored Lot J testing location has conducted 565 tests as of 1 p.m. today. Yesterday, we expanded the age requirements for testing to people of all ages. But those who wish to be tested still need to meet the criteria of a fever of 99.6 degrees or higher and respiratory symptoms. This location is also available to first responders and healthcare workers who have direct contact with patients. Lot J site is federally operated and is open to citizens from throughout our region. There is no cost associated with this testing location. We've been getting questions about why testing is limited to those who display symptoms. And this is frankly so we can conserve critical supplies and treat those who present the most serious risks to the community. Of course, it has been shown that people can be carriers of COVID-19 and not have symptoms. That is why we're encouraging self-isolation and social distancing. Mental health. This is a strange and unusual time. People's lives, people are isolated, their lives have been disrupted. We're currently gathering resources to make sure those struggling with mental health and the disruption will have access to those resources. We're looking at ways now that we can be helpful there. Some immediate things we can do. Take times to call friends and family. Call your neighbors just to check in. You know, I was talking to my mom and dad this weekend, and I have my kids range in age from 15 to 10. My mom and dad were reminding me that for the last 15 years, many, if not most weekends, they were with their grandkids, my kids. And that's all been disrupted now. So we just decided over the weekend, we got the phone, put it on speaker, and we all as a group just talked about our day and what we'd been doing. I'm going to start taking pictures and sending them. We can all do this with our friends and family to stay connected. Listen to music. Listen to something you haven't listened to before. Set a routine. Get up in the morning. Get dressed. Know that there are certain things you're going to do. If you can, exercise. Look, we are all in this together, and we've got to take care of each other. In conclusion, I know these are tough, worrisome, and trying times. Many of our citizens are struggling and very, very anxious about what the future holds. Our lives, our support circles have been completely disrupted. We are out of our normal routines. I recognize the stress this causes and the strain it puts on our health, our mental health. I'll continue to think and pray for the people of Jacksonville, the surrounding area, and frankly of the world. But my team and I, with all the people that are working on this, are going to continue to work every single day to flatten the curve, save lives, and get everything back to normal. For now, let's stick together and do the hard things that will stop the spread, and let's all be helpers. With that, we'll take questions.
Mayor, this is Jim Pickett with Channel 4. On the field hospitals, what have you been discussing? What types of patients do you think would be there? And when could we start seeing them being set up here in Jacksonville?
I've got Chief Powers on a virtual in another room. I'll have Chief Powers answer that question, please.
Yeah, Jim, this is a field hospital that has the capability of handling about 250 critical ICU patients, and it's expandable. We can expand it, but currently we're just staging it here in town. And right now our hospitals are not at capacity. And when that determination is made by the mayor's office and those hospital leaders that we need to get it up and running, a decision will be made to do that. But until then, it's just going to be staged. The equipment's just being staged here.
Sky with WJCT.
Hey, Mayor, I just want to ask it, what else would you need to see from the city in order to maybe further consider a lockdown or a curfew for the city? What more do you need to see for that to happen?
Look, what I'm going to add to this executive order that says if employees can work from home, the executive order will require that. Another example of call centers, we shouldn't have people packed in. They should be 6 feet apart. It seems that most people are taking this seriously. And so in an effort to not disrupt business unnecessarily, we're asking people to practice this. The issue, even with a full shut-in, if you will, is how do you enforce it? And as I said in my remarks, if we don't flatten the curve and because of people not social distancing, I would expect to see some sort of federal or state order, and they'll have the resources to enforce it. So we'll continue to monitor this and make decisions that I believe are the best decisions to keep people safe. Anthony with First Coast News.
Hey, Mayor, my question for you is about the cases at Camellia at Deerwood. So we understand from yesterday in the press conference that that's going to be considered a hot spot and that you guys were going to help with cleaning and also with any staff guidance. Can you talk a little bit more about that, and also how many cases are there and also how many deaths have occurred there to confirm that information for us?
Sure, thank you. I'm going to have Director Woodard answer that question, please.
Yes, we are working closely with the Department of Health.
I'm sorry, you're the fire chief.
You need to understand, please, that they have advised us this is an ongoing epidemiological investigation. So they're not able to share a lot of the specifics with the public. What I can tell you is that we recognize there have been several cases from Deerwood facility. We've been working with them since the early days that this disease first shown its presence in Jacksonville, and we continue to do that. We are in constant contact with the facilities that are having any patients that come to our attention. There is a special team that the Department of Health and the state have set up. We are managing that team, and that will consist of personnel from the Department of Health, physicians, epidemiologists, infectious disease personnel who will be able to work with that facility and any other facility in the region that does have a significant number of patients. And that is being led by Jacksonville Fire Rescue Department, working with all of our partners.
Fire Chief, if you have anything to add to that, please do. If not, we'll take the next question.
Director Woodard answered everything appropriately.
Thank you. Christy with Action News.
Hey there. Wondering if hospitals have enough supplies in terms of masks and protective gear. Is there any concern that there may not be enough?
I'm in regular communication with them, with the leaders of the hospitals, as our emergency operations center. I know that they're chasing supply chains, as are we, and have had some success. Either Director Woodard or Chief Powers, you may want to add to what you know as well. Chief Powers or Director Woodard.
Yes, we have been working over the last 48 hours with the limited supplies that we have, and we've been able to get some of those commodities out directly to 32 facilities, and we have been delivering those with our staff, and that includes over 3,600 N95 masks, over 25,000 surgical masks, and over 400 packages of hand sanitizer. As additional commodities and supplies come in from the state, we will be quickly distributing those to the facilities who need them most. So we believe we're going to be able to keep up with this. We're working closely with the state and processing any requests that those facilities have.
Christopher Hong with the Florida Times Union.
Hey, Mayor. A question about the regional hospital. You said it's a regional asset. Is this a facility, if it's open, that would serve patients from around the state or throughout a region?
Yes, that's correct.
Okay. And I mean, is this something that's being set up around the state, or is there a reason why this is happening in Jacksonville?
Either Fire Chief or Director Woodard, either one. Director Woodard, go ahead.
Yes, the field hospitals are available, a very limited number. So we, with the, given our significant number of healthcare facilities, hospitals here in Jacksonville, and looking at the possible need, we wanted to be proactive. So we've worked closely with the state and bringing in the field hospital early in the event that we do need to set that up.
Who is next? Kelly, News for Jax.
Hi, my question has to do with the long-term healthcare facilities. We know from the state numbers, there are 14 residents in long-term healthcare facilities in Duval that have tested positive. Are those all out of Camellia at Deerwood, or are there other facilities at this point in Duval that have residents testing positive?
Director Woodard.
Yes, once again, we're not able, the Department of Health, because of Florida statute, has prohibited us from sharing very specific information. What I can tell you is that as patients are identified, we're working closely with Department of Health, with all those facilities to track those patients, to track the personnel from JFRD and other organizations that might have had contact with them. This is obviously an illness that impacts disproportionately the older population, and we're closely monitoring any activity. Every case is important, but we do understand the significance of any case in a facility. And as an example, as you mentioned, Deerwood, there were, when these cases first started, 217 residents there. That number has changed somewhat because of patients being transported to hospitals. But I can assure you we're closely working with any facility that's impacted. And this incident management team that we're standing up today will be able to ensure that those facilities get the services they need.
We got Jim Pickett. After I answer that question, I'll take one more. Go ahead, Jim.
Well, Mayor, I guess the question being, what are they seeing at these testing sites? Are people coming in with severe symptoms? What, you know, I know we won't get results back until later in the week, whatever, but what are the healthcare workers telling you? What kind of condition are these people in?
Well, as you know, at Lot J, the requirement is that you got to have a 99.6 degree temperature and respiratory issues. I will have, who would answer that? Who would have that information? Director
I can,
or fire chief?
Mr. Mayor.
Yep. Hey, that's our fire chief. Thank you.
So Jim, I was down there this morning and looking at some of the people that were coming through in line, and obviously a lot of them look like they don't feel real well. But because of having, you know, the requirement for them having a fever and having respiratory symptoms, they're not, you know, feeling the best. But obviously the goal is to get them tested so we know, you know, can let them know if they're positive for the COVID virus or not.
Anthony with First Coast News.
Yes, Mayor. So we've heard a lot of concerns from business owners. I know you just mentioned that you're asking if they can do so, have their employees work from home, or if they do come into work to be 6 feet apart. But how are you balancing the economic concerns and also the health risk as well? What is that like for you? What are you telling our business owners from there?
Well, what I said today, and that's why we're putting it in executive order. You know, I'm hearing anecdotally that there are employees that could perform their job functions from home, and some employers aren't allowing that to happen. And so they should be. And if they have to be at the office to do their job duties, they should be 6 feet apart if they can be. And then obviously also practice all of the hand washing and hygiene, sanitize efforts we've talked about. So the priority is safety of our people and to flatten the curve and stop the spread. I want to close, done with questions for now. I just want to close on something I touched on before about the importance of the fact that our lives have been disrupted. And again, the importance of what that means for our mental health and how some little things. Look, depression is real. I'm not suggesting these little things are a cure for depression. But where mental stress has set in because of this disruption, again, checking in with neighbors, calling grandparents, friends, people you care about. I had two things this weekend, in addition to the call with my parents, that touched me and made me feel a sense of normalcy. Molly and I decided to tune in to our church online on Sunday morning, and we tuned in on our normal time. And I remember thinking, before we did it, it's going to be odd. But you know what? It felt like a sense of normalcy. And then this morning, my daughters were up at 8 o'clock doing the virtual school. And I watched my 10-year-old having a conversation with her teacher. And A, the kids are learning, but B, that brought a sense of normalcy. So we all need to try to get routines and find things that work for us while we're isolated with either ourselves or our families. Thank you.